Hi everyone, I'm Ivana and she's Noor. She's 13 years old and she came to Italy to undergo the Neridronate treatment for her CRPS. And she came to Italy with her dad, Brent. Hello.
Hello.
So, would you like to tell us how did the treatment go?
It went pretty good. We got an IV in my arm, and I sat there for like 2 hours. It was pretty good, but I had some side effects. I had some joint pain and a little bit of nausea. It went away pretty fast with the prednisone, though.
And how was the nurse with you and the doctor and the whole medical stuff?
They were all very nice and encouraging, and that helped me a lot because I was nervous at first.
What are your impressions about our service and also about the medical clinic and all the stuff?
Yeah, I think we were apprehensive at first when we were doing our research before we came, and everybody's put us at ease. Emily, Ivana, and all the medical staff was very, very kind and very, they went through it slowly, so we understood what was happening, and we were a little anxious about getting an IV, and because we've had experiences in the past with having some pain with just giving a little bit of blood, and the nurse took her time and did a real good job. Didn't have any problems before, during, or after with pain in her arm with the IV, so that was a positive. And we kept that in for all 4 days of the treatment, and the actual infusions went smoothly. After the second infusion, that's when you started experiencing the side effects of the joint aches and a little bit of nausea the next day. Now this is the fifth day where we didn't have an infusion, just had physical therapy, and things have calmed down a little bit. Not as much nausea, hardly at all, and only using the wheelchair just to alleviate some of the aches and pains that we had from side effects. So we hope to wean off the wheelchair tomorrow and the next day when we go home.
Also, on the last day of infusions, we had the visit with doctor, and so the doctor gave her advices and medicine to control the side effects. So now she's taking prednisone for the side effects,
Right.
which are slowly going away, right?
Yes, the joint aches are definitely better, and I barely have any nausea.
Really nice. So we had the last PT session this morning. How did it go?
It was good. I've never really done anything like that before in America, but it was focused on what I was like isolating my body because it hurt that way. So they found exercises that helped me or will help me get into better function.
Would you suggest to other patients to come to Italy and undergo the treatment?
Yeah, I would definitely encourage anybody thinking about it. There's nothing to be afraid of. At least in our experience, it was. I mean, the research. I encourage everybody to do the research and find out for yourself. But it really was a non-event as far as any reaction other than the normal bone aches, and that aren't going to be permanent at all, just a very temporary situation. This is our first attempt outside of physical therapy to do anything, so we haven't been on any drugs other than Tylenol. Nora's had this for a year and a half, and this seemed to be the best option for us, especially at her age.
Okay, so pretty good impressions. And currently we are in Marostica. We are doing some sightseeing with the cars, and it's kind of a nice day. Kind of, it was. And do you have any moment that you have been, since you have been in Italy, that you actually remember as a really good moment and that you actually enjoyed?
I liked all the sightseeing when we went to the castle. What was that called?
Suave.
Suave. We also went to the Olympic Theater. That was all pretty cool.
Mhm.
Sometimes can hardly believe that I'm in Italy. It's hard to believe.
All right. Thank you a
Okay.
lot.
Thank you.
And we will go in to do some more sightseeing now. And thank you for your testimonial.
Thank you.